welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's updates from the medical world. Standing desks alongside other measures which may cut office workers sitting time by an hour a day. Using a standing desk alongside a package of other measures to encourage office workers to sit less and move more, reduce sitting time by about an hour a day over 1 year, finds a trial published in the BMJ journal. A growing body of evidence indicates that sedentary lifestyles are associated with higher levels of chronic diseases including heart diseases, type 2 diabetes and some cancers, and higher rates of depression and anxiety. Office-based workers are one of the most sedentary populations, spending 73% of their workday and 66% of their waking days sitting, but studies looking at ways to reduce sitting in the workplace have been deemed low quality. To address these research gaps, a team of researchers based in the UK with collaborators in Australia set out to evaluate the impact of smart work life, an intervention designed to reduce sitting time and increased moving time at work with and without a standing desk, delivered by workplace champions. The trial involved 756 office workers from 2 councils in Leicester, 3 in Greater Manchester and 1 in Liverpool. Participants were randomly assigned to the SWAL intervention, with a standing desk or a control group over a 12-month period. The SWAL intervention group were given a range of resources to help them reduce their sitting time and highlight the health risk of too much sitting. The SWAL Plus desk group also received a high adjustable desk to encourage less sitting time. The control group carried on working as usual. Small but non-clinically meaningful improvements in stress, well-being and a sense of work-related vigor were found for both intervention groups compared with the control group at 3 and 12 months, as well as lower limb pain in the SWAL Plus desk group. These measures were also linked to small improvements in stress, well-being and energy levels at work, although the researchers stressed that these improvements were not clinically meaningful. Although time spent sitting was lower in both intervention groups compared with the control group, the researchers note that most participants simply replace sitting with standing, and they say further work is needed to encourage more physical activity, particularly outside of working hours. The absence of any link between COVID-19 vaccination in pregnancy and higher risk of preterm birth or stillbirth. Vaccination against COVID-19 during pregnancy is not associated with the higher risk of preterm birth, small for gestational age at birth, or stillbirth, concludes a large study from Canada published by the BMJ. COVID-19 infection during pregnancy has been associated with higher risk of complications, including admission to hospital and death for pregnant individuals, as well as preterm birth and stillbirth. COVID-19 vaccination during pregnancy has been shown to be effective against COVID-19 in pregnant individuals as well as their newborns, but evidence about pregnancy outcomes after COVID-19 vaccination during pregnancy from large studies is limited. To address this, researchers set out to assess the risk of preterm birth, small for gestational age at birth, and stillbirth after COVID-19 vaccination during pregnancy. They used a population-based birth registry to identify all live-born and stillborn infants with a gestational age of at least 20 weeks or birth weight of at least 500 kg in Ontario, Canada between 1st May and 31st December 2021. This information was then linked to the database that captures all COVID-19 immunizations in the province. Of 85,162 births, 43,099 occurred in individuals who received 1 dose or more of a COVID-19 vaccine during pregnancy. 99.7% received an mRNA vaccine, mainly Pfizer or Moderna. The researchers found that vaccination during pregnancy was not associated with any increased risk of overall preterm birth, spontaneous preterm birth, or very preterm birth. No increase was found in risk of small for gestational age at birth or stillbirth. Findings were similar irrespective of what stage of pregnancy vaccination was given, number of doses received during pregnancy, or which mRNA vaccine product. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.